Usually, patients are trained within the hospital. Previous day of the surgery, they are taught all the exercises and along with the spirometry, which is a deep breathing exercises device. Post surgery, from day 1 onwards, all the patients are made to walk on day 1 itself, and they are toilet trained, and before they get discharged, they climb staircase up and down. These exercises are very simple and usually takes 3 to 4 weeks only for the patients to recover. If you want all the exercises since being taught in the hospital, you can easily continue at home. If you need help from a physiotherapist, then you can avail it. You can undergo a knee replacement surgery. Only thing what we have to do is, we have to stop the blood thinners 3 to 5 or 7 days prior to the surgery, depending upon the tablet what you are taking. Usually after the surgery, on day 1 itself, we will allow the knee to start bend and do all the exercises, and you can move around comfortably with ease. You will not have any difficulty in bending your knee or walking post surgery. Ideally, if you have pain in one knee, you should get operated only for that knee. If you have pain in both the knees, then both knees should get operated. The question comes is whether to get operated both knees at single sitting or in 2 different sittings. Then probably you can discuss with your doctor and decide whether you want to undergo both the knee in a single sitting or in a staged manner.